Warm welcome to you, those of you who are just joining us on social media. Welcome. We're about to get started. You can see we're 1 minute 24 seconds away from launching the Action Plan Hackathon. Hackathon is what people in IT work with computers call it when they try to solve a problem. They hack away at the problem until they break through and find the solution. And that is what we are kicking off today for immunization, and specifically for the world's strategy for immunization called Immunization Agenda 2030. We'll see you soon in 55 seconds. Hundreds of immunization and other primary healthcare professionals are gathered right now in our Zoom studio. It is the 9th of May. We're 27 seconds away from kicking off the first Action Plan Hackathon of the Movement for Immunization Agenda 2030. You can count with me. We did this when we first launched the movement. 8, 7, 6, 5, 4, 3, 2, 1. And here we go. We're launching the Action Plan Hackathon today with hundreds of immunization professionals, many more connected via social media. This is about the movement for immunization. And that movement is right now, as of today, this number changes every week. You see it keeps going up. 44,726 immunization professionals active on our platform from over 110 countries. This is not only about the links, the connection that we have with you. It is the connections that you build with each other as we kick off the full learning cycle since 7th of March, a complete kind of package of action from knowledge all the way to the point where you will be reporting back to this assembly. I have achieved a result. I have made a difference. Here is the evidence of that result. That is the day we're all waiting for. Now, the Action Plan Hackathon starts today. We'll be going through the 20th of May. And in order to understand what has changed with this movement, how has the movement changed you? And if you're new, because many of you in the room are, going to ask you, what do you expect from this movement? So let us turn to the room. I've lowered all the hands and seeing many people online. Let's go to, all right, Barnabas, maybe. We heard from you before we started, but it'd be lovely to hear from you again. Barnabas Chamolo, please do introduce yourself. Keep in mind, people listening now have not heard what you said before, but it'd be great to hear what do you expect from the movement. And please do introduce yourself.
Good evening, I'm Barnabas Chamolo. I'm from Kenya, in Marakwet County. I'm the head of the district in charge of the vaccines and logistics. I'm very happy, very delighted to join such a wonderful team like this from all over the world. I'm looking forward to learning new ideas, new ways of how to improve vaccination in my country, in my county, and in my community. I want to reduce the number of zero doses in the community. And in this way, I'm looking forward to learning so that I reduce those number of zero doses in my country. I also want to improve the immunization coverage in the entire country, Kenya. So I'm very happy and I'm looking forward to learning a lot from you people. Thank you so much.
Thank you, Barnabas. And we have many people joining us online, such as Fateh Azmatullah from Pakistan, Robert Ninson joining from South Sudan, and Amel Altahir from Saudi Arabia. Both familiar and new faces are all welcome to this movement for Immunization Agenda 2030. Let's hear from one more person. We have Ahmed Niyama, already many hands raised, as well as I thought I saw, and a call to the women who deliver vaccines. We heard you last week, just 1 week ago. Heard your voices, heard your commitment to improving immunization, So please do not be shy. If you are a woman in our studio, raise your hand so we can hear your voice as well. Ahmed Niama, a warm welcome to you. Please tell us, when did you join the movement, and then answer one or both questions on your screen.
Thank you, Rida. I'm Ahmed Niama from Iraq. I'm the only participant in Iraq, and I'm trying to encourage all my colleagues to participate. I'm working with the International Committee of Red Cross, and we're planning to start a support program for the national immunization program. So I joined the movement since March. Actually, I did the application in beginning of February. So I joined from March.
Wonderful, Ahmed. And so,
what changed?
Yeah, what has the movement changed for you?
Well, believe it or not, the movement provided a huge support for me. First of all, I realized that defaulters and challenges in immunization system is not only in Iraq, it's all over the world, and we all working hard trying to improve it. So this was a huge support for me. So I felt I'm not alone, and I have colleagues working for the same purpose all around the world. So the idea engine was like the source of all the great idea I used for our program. I also tried to contact some of the colleagues all around the world and also I had some question. I wrote it in the comment, and I had a nice and informative replies. So this is like we all colleagues from all around the world working for the same purpose and trying to help and support each other.
Wonderful.
In our programs or on our daily work.
Indeed, Ahmed. Thank you so much. Wonderful. Now, I did see the hands of several women who deliver vaccines, both members of the collective and those, but they went back down. So I'm going to turn to Joy Atawodi. Joy, please, you have 2 questions up on your screen. Tell us when you joined the movement and answer one or both questions. And don't forget to introduce yourself.
Everyone. Good evening, Reda. Thanks, everyone.
We hear you loud and clear. Go ahead, Joy.
Hello? Okay, thank you. It's been so great being in the movement. One thing, my name is Joy Atawodi. I work as a supervisor at the management support team at the national level. One thing in Nigeria. So one thing the movement has changed for me is the knowledge that challenges that I face even in Nigeria, to know that they are not unique just to me or to Nigeria, but that these challenges are bound with other immunization experts all over the world, has been a great eye-opener for me, and it has made me realize that these things are doable. And so I expect also from the movement, because the ideas engine, for example, I see it as a large compendium of ideas that is helping to help us solve the challenges that we have from great experts that are from all over the world. So this has really been great, and I'm expecting that this will continue, and I will get more, even from the, from networking with other experts from all over the world. It will help me to even be able to solve some of these challenges, and it strengthens me, gives me hope that we can together solve the problem of immunization. Particularly, I'm interested in vaccine hesitancy in my place, which is a big problem in my own place. Thank you very much.
Thank you very much, Joy Atawodi. Let's go now to Christine Omanyo. Christine, do introduce yourself. Tell us where you're from, what you do, and then tell us when you joined the movement and what has changed and what you expect.
Hello, everyone. This is Christine Omanyo, speaking from Kenya, near Lake Victoria, Western. Now, this movement has changed how I reason, how I think, and how I also supervise my junior. This is when I read about the strategic plans, and through the ideas engine, I shared and I reached up to analysis, or the situation analysis of my problem. And my problem was that how should I sustain monthly utilization, monthly access for all the facilities that I'm supervising, because I'm the EPI coordinator in my sub-county. Now, I've gained a lot of skills and knowledge when I did the coffee partner, and I received the knowledge that I'm also putting in practice to adopt a child. That every person working in a hospital and the community health workers, they have to adopt a child and adopt a household and work with the child until the child finishes the immunization at 5 years. Thank you.
Thank you very much indeed. And I can see many, many more hands raised. It is not a surprise, because and this is really incredible. 3,555 immunization professionals registered specifically to develop an action plan for their Immunization Agenda 2030 challenge. So let's see, we'll see how many get to the finish line, but it is certainly out the gates an impressive number of immunization and other primary healthcare professionals who are joining this hackathon to develop an action plan, knowing that after we develop the action plan, we will be implementing together as well and continuing to support each other in the amazing ways that so many of you have already done, and will be warmly welcoming the ones who are joining us now. So let me now again lower all of the hands just to start fresh, and I would like to now turn to the first question of the IA 2030 action plan, which has to do with being clear about what you want to achieve. And I can show you right after the, let me give you a sneak preview, right after the assembly, right after this meeting, you'll be receiving the link, the personalized link, to go to the questionnaire that will really guide you step by step in developing your Immunization Agenda 2030 plan. But for now, we'd like to hear firsthand. You have the questions up on your screen. I'm going to post them here into the chat for those of you who are on your phones. And so please raise your hand, especially if you are new, especially if you are a woman. And our rule is that after one person from one country or one gender has spoken, that the next one should be from another country and from the other gender. So I'm allowing those of you to talk. So Hassan Benya, you're the first one to have unmuted your microphone. The floor is yours. What is your priority challenge? Please don't forget to introduce yourself. What is going to be the objective of your action plan? And then we're going to ask you for one corrective action. After that, I'll be turning to Dr. François Gass, who's been with us since the beginning of the movement, for feedback, for comments, and to challenge you with further questions to ask. Hassan, please go ahead.
Yeah, I'm Hassan Benya from Sierra Leone, West African part of the Africa. So I'm the senior analyst for vaccine management in Sierra Leone, supporting the Ministry of Health. I'm currently working with Clinton Health Access Initiative, CHI. So one of my major priority areas is improving the data management and quality in terms of supply chain and then a cold chain system. That has been one of the biggest challenges I've observed. You know, we observe that most of the commodities definitely people are using, they are not accounting of it. And as a result, again, even those that are accounting of it, they are not really giving us the good information we may want. So one of my objectives to that is to make sure that I build capacity in terms of data management and reporting to strengthen health interventions for routine immunization. That is my major objective I will be focusing. So one of the corrective measures I really want to put in place is to make sure that we build capacity by making sure that one-on-one mentorship, because I find out that training alone cannot solve issues. One-on-one mentorship and coaching can actually be one of the major points to really minimize the data quality challenge. And then the second point, the second corrective measure I want to put in place is to make sure that people are familiarized with the tool itself, because using the tool, again, is another point. Because if you don't know the tool, definitely you find it difficult to really enter what you want to do. So I think those are the major areas I really want to focus on. As per questions, I think that's all I have for you. Over.
Thank you very much indeed. Now let's turn to Dr. François Gass, and I'd like to ask all of the participants if your colleague came to ask you, what do you think? This is what I'm thinking of my challenge, objective, corrective action. What would you tell him? If you can put your answers in the chat, and then we'll hear Dr. François Gass, what François has to say back. François, warm welcome to you as well.
Merci. Thank you, Reda, and thank you, Hassan, for sharing your answers to the 3 questions Reda put on the screen. I think you have addressing the very nice objective is building capacity on 2 aspects, which is coaching and using the tool of all your people to improve the quality of data. But my first question is, when you identify this priority challenge, what did you find in your situation, and what was the key finding that made you set that objective and that those 2 corrective actions? How did you come along? Do you have some figures? You have some finding from your analysis? Can you share?
So I no longer see him in the. His microphone is unmuted, so we may not be able to get. We may not get an answer, but. In order to, what I would recommend is tomorrow, not a week from now, but tomorrow, François is holding an experience sharing session in which you can come and he will help you both with your action plan, and you can help others by sharing your experience. So I'm going to share the link in the chat now, and if you're in the Zoom studio with us, you can go ahead and sign up for tomorrow's session. There were hundreds, 376 people in the room right now. That's just amazing. And we know, of course, many people are not able to attend because of connectivity issues, and so there are many more in numbers and many other work-related issues, but here we are. So please go ahead and sign up for the experience sharing. And let's go to Priyanka Bajaj. Priyanka, I'm going to put the questions back on for you. Let me find the right ones. Yes. So really to understand your priority, challenge, objective, and then just 1 corrective action.
Sir, I am working as consultant in Ministry of Health from India. I have recently observed that there is over-reporting in our immunization. So this is the priority challenge in our country to correct this over-reporting. And objective of this action plan is that over-reporting should be minimized so that we can identify the leftover beneficiaries. And so I have tried to connect capacity building of the cold chain handlers and ANM at district level so that they can know how to report, so that there is not over reporting of in our system.
All right, I'd like to go now to François Gass. What would be your first question for Priyanka?
No, I would say, how did you find out that there was an over-reporting?
Sir, there is in our national team, there is a portal named at HMIS system, Health Management Information System. In this, we report. We are doing data entry. We have to from entry level, they have to do a data entry, how much immunization they have given, how many children have they have vaccinated. But in this, there is only number counting. There is not the number of name of the children. So there is a over reporting system. Sometimes the ANM not on is a who is a cold chain handler also who report doing cold chain monitoring of both the hospitals. So he or she reporting to in a hospital to both of the in a system. He reports two districts, two hospitals.
Okay, thank you very much. And your corrective action, I think is very clear that there is an over-reporting and you have digged in. Now, it would be very important to, your corrective action is, and you have identified the why, and I think your corrective action sounds very concrete and promising. Thank you.
Thank you, Francois and Priyanka. I am now showing on screen the actual questionnaire in which you will develop your action plan for Immunization Agenda 2030 around a specific challenge. And this is a guided process. Simply answer the questions, take the time to answer them. Remember, and this is actually key, is that you're not doing this for us. You are doing this for you, for your needs, for your challenge, the challenges that you are facing, the way to help you in your work. So this is by no means an academic exercise. So put into it as much or as little time as you need to in order for it to be a useful exercise for you as you progress in the movement for Immunization Agenda 2030. So the first question is, just as we just heard Priyanka say out loud, Priyanka, when you start the Action Plan Hackathon, there may be some questions, some preceding questions that will be there. And then you will have to actually write out, describe one challenge you face in your immunization work. Now, we suggest you focus on your most difficult and important challenge, but it's really your priority challenge that we're trying to get at. Once you answer that, and you can see it looks like there's only room for one line of text, but you can actually put a lot, take as much time to answer, write as much as you want. Now, those of you who completed the IA 2030 movement application, you have answered this question before. Why are we asking you to answer the same question again? Because, especially for those of you who did situation analysis, you probably have improved your ability to describe, identify your priority challenge. After you sort of describe as much or as little as you want, you summarize your challenge in one sentence. And so you have 256 letters, basically, and spaces to say, my challenge is this, and I want to do that. So that is the next question that you have to tackle. After that, we ask you to do a kind of self-evaluation. Is your challenge too broad, general, or vague? Like if you say, my challenge is coverage is too low, or my challenge is unvaccinated children, you probably need to improve your challenge. So that is the next question. Now, after that, we ask you again, this is Immunization Agenda 2030. So we ask you to sort of classify your challenge. Where does it fit in? Is it primary healthcare and universal health coverage? Is it commitment and demand? Is it coverage and equity? You choose. It doesn't have to be perfect, but it has to feel right to you. Next, you have a much longer list, which is what are called the key focus areas of Immunization Agenda 2030. So this is much more specific, or a little bit more specific, and you have to choose. Take the time. There are 47 entries, so take the time to read all of them in order to choose the right one that fits for you. And then this list, there are 10 items here. One is none of the above. Where does this list come from? This is what the World Health Organization has said were the top challenges at the last meeting of the WHO Executive Board. So it's important, if your challenge relates to something that WHO is saying is a top priority for the world, that's why we're asking, that's why we want to know. So every question has a purpose. We do not want to waste your time. Quite the opposite. We want every question you answer to have a light bulb going off, say, oh, yeah, now I can clarify my challenge. Now I can clarify my objective. So in this case, in English, we've called it a goal. And so we want you to define the goal of your action plan. And again, you have only 256 characters to do that. And then the critical question, you can set anybody can set a goal. The key question is, or one of the key questions is, why is this goal important to you? Why does it make a difference? What will be different if you actually achieve this goal? And then we ask you, have you started to take action toward this goal? And there are most of these questions, there's no right or wrong answer. So if you did do things, if you're already working on this, just say yes. If not, you can say no. It's fine. Summarize what you've already done toward the goal. Now, if you have done things in the past, tell us what you did so we can better understand it. And this is also a review exercise for you to understand what your path has been to then be able to decide what you're going to do next. Now, we ask you about stakeholders. Nobody implements an action plan on their own. Action cannot be in isolation. So we ask you, who are you going to need to work with to achieve your goal? After that, we ask you about funding. It's a simple yes or no question. Do you need more funding, or do you have everything you need? So that is the next question. Then we ask you logically, this is more resources, time. Time is the most precious resource. How long do you think you need to achieve the goal that you set for yourself? And then we ask you can tell us more, because often resources and timeline, it's not just do you need more, do you need money and how long it's going to take. There's more to say than that. So as you work through the questionnaire, we'll be sharing the Word document so you can review the questions offline, prepare your responses. But the only way you can actually answer this questionnaire is online, in fact. So that is what comes back to this first part, the priority challenge, the objective, and then the corrective action we'll get to next. There are actually 3 corrective actions. We'll get to those next. Now, what is the point? At the end of the day, or more specifically on the 20th of May, all of those of you who make it to the finish line will have an action plan. And so we'll ask you a very simple question. Are you ready to take action? You can say this was just to help me a little bit, but I don't want to go further. We hope that you will respond that you are indeed ready to take action. And to get started with that process, you need to start by developing your action plan. But we'll go back right after you've submitted your action plan. You'll be able to figure out what your next actions are week by week and share with fellow members of the movement your successes, your lessons learned, your challenges. But step 1 is first to develop that action plan. If you developed an action plan already in the WHO IA 2030 course or any other context, you'll be able to bring that in. You will have to complete the questions. What you're seeing here, this orange button, is what will be sitting in your inbox once this hour is up. So at the top of the hour, everyone in the movement who said, I want to join the hackathon, will receive the email that contains this link and also the link to download the questions so you can review them before you start. That is what we'll be doing. I want to mark a pause before we go to the corrective actions. That's really an important section. So, we ask you, we're going to turn to you. I'm going to, again, lower all hands. Feel free to raise them up again. I just want a clean slate, let's say. So we'll ask you to specify a corrective action and then answer the questions that are on the screen. Just want to greet a few more people who've joined. So Sharish Shahid, while the hands go up, and Rogers Kuotong Nongo from DRC, Steve Mwangi from Kenya. A warm welcome to you. And let's see, Sona VK from India as well. El Hussein Kauru, who says, I didn't register for this event, but I'm always with you. Thank you, El Hussein. And then Geneva Learning Foundation will provide a platform for scholar alumni who work with WHO for immunization, who work with any of the IA 2030 partners. And then we have our dear Atahir Abubakar, an important leader in the scholar community, who also says hello. I'm going to stop here because I figure there must be many, many hands raised indeed. So let's go to Isaac Mumba. And then Isaac, are you able to speak to us? I'm going to...
Hello, good evening.
Yes, Isaac, we hear you. Don't forget to introduce yourself. Remind us, what is the objective? What's the goal you're trying to achieve with your action plan? And then answer the questions on screen, please.
Okay, so I'm Isaac Mumba from Zambia. So actually what I've identified at my facility is the uptake of measles vaccination that is given at 9 months so that the baby can be deemed as fully immunized. So for me, this has come to light that there is a knowledge gap in the community from the health facility, meaning that the people in the community, they don't have the information as to why we are deeming a baby at 9 months and not at 3 months, 2 weeks, where we give the first doses for example, DPT, PCV, and all those. So my objective is to make sure that the community have the right information and also the correct one, and making them to create the demand for the measles vaccination at 9 months to all the babies that are turning 9 months. Remember, this acts as a cohort. So those babies that are born in the same month, I should have them at 9 months, all of them. Taking, for example, if there are 15 of them born in January, it means that the whole lot of 15, I should have them in October. So this is when they are going to turn 9 months. But unfortunately, when you do the data review, you find that out of 15, maybe just 4 or 5 come through for measles vaccination at 9 months. So really, my objective there is to make sure that the information reaches the recipients of care, more especially the caretakers, the mothers, and all those caretakers of these babies, so that they can be bringing their babies for measles vaccination at 9 months at my facility. I submit.
Thank you, Isaac. François?
Yeah, yes. I think the presentation is very clear from this colleague in Zambia, and he defined. I think he defined the overall problem, which was his coverage was for measles was low, and for causes that he has identified, the lack of knowledge to return to at 9 months to get the first dose of measles, and he has analyzed data, and he found that there was a dropout between the first dose and the first dose of Penta, and this is excellent, is what's expected. Now, in terms of corrective action, then he is identifying some community sensitization to explain why the child should come at 9 months, and he seems to have some data to base in and to see his corrective action is going to lead to the result he's expected. So I think you're doing the real process that expected to develop your plan of action. Thank you very much. Felicitation.
Thank you, François. And Isaac, what you will find when you go to the actual questionnaire, you can see here. So you'll be taken through the cycle, ask the same questions 3 times, each one for a different action. So it is by going through, you click on continue. And action 1 is simply, what do you want to do? In relation to your challenge, of course, and your goal. Have you done this before? Yes or no? Is this an action that you've carried out many times before? Who's actually going to do it? Will you do it? Will others do it? Will you do it with others? That is extremely important. You cannot say this action needs to happen and then not know who is going to do it. How much time do you need to finish this action? This question is 4 weeks or less, or more than 4 weeks. And that is in part because the Impact Accelerator Launchpad will be 4 weeks. So if you have an action that you feel you can finish within 4 weeks, it will be suitable for the Impact Accelerator Launchpad. Otherwise, you will have to break it down to figure out what you can do within 4 weeks. Now, we also asked you a question was, how innovative is this action? It doesn't have to be, again, there are no right or wrong answers. This is not a quiz or a test. You tell us, is it something, if it's not innovative, if it's something that's tried and true, you've used it, it works, it's an action that delivers results, it is fine if it's not innovative. But we do want you to sort of self-assess. Do you think that the action you're proposing with respect to your goal to help achieve your goal, is it innovative? And then you can just freely tell us more. Explain why this action matters. How will this help you achieve your goal? What needs to happen and when? What are the steps to finish this action? And again, answer these questions. Take as long or as a lot or little amount of time, based on, so that it is useful to you, so that you can use your action plan. At the end of this process, you will actually receive your action plan in your email inbox. And that is when we'll come back to you and we'll say, are you ready for action? are you ready to join the Impact Accelerator? And you can see here, I'm now on the second specific action. And again, if I scroll through, you'll see it's exactly the same questions, but it should not be the same action. Please don't paste in the same things you put in for action 1 here. So I think we have, all right, let's see, we have a lot more messages coming in from social media. We also have a lot of hands raised. And we did promise Ahmed Niyama. Apologies to those of you who have not gotten to, did not get to speak on the first round. Ahmed, we'd love to hear from you in the Iraqi context, if I understood correctly. Remind us your goal, and then give us an example of a corrective action that you want to take, you want to map out.
Thank you, Rida and Francois. Yes, I'm the only participant from Iraq for the corrective action. So I have worked on immunization before, to be honest. But I worked on emergency response, and also I worked on the isolation centers of COVID pandemic. So this is my first time working on a pre-existing program, which is immunization. Working step by step, depending on this movement, actually. So that's why I'm following up all the updates and participating all the activities of the movement, just to expand my knowledge and gain new skills that will help me in my daily work.
Okay.
Who will carry out my corrective action? Actually, I'm working with the governmental sector. So I'm working with the health sector and primarily healthcare centers. So actually the daily work and actual work are done by the health workers. I'm just providing like logistical support, training, and formulating the steps of our plan. The first thing I'm planning to do, to be honest, is to like having an advocacy of this movement, just to show the importance of the immunization program and how we can develop it. Also, I'm encouraging all my colleagues to participate in the movement, so it will be like a huge support for me. How long it will take? I'm planning to have a project for 6 months, because my main challenge, a priority challenge, is the defaulters. Because of the pandemic and all the vaccine hesitancy that's caused, because people are afraid to visit the healthcare center and receiving the vaccine. Also, some people are linking the immunization program with the COVID vaccine, with the COVID pandemic and all the side effects. And this is what I discovered during the focused group discussion with the community. So it will take me 6 months to see the real impact of this project. Also, it will be monitored day by day and have monthly evaluation and reporting, so we can find out or sensitize the impact on weekly and monthly basis. But the final evaluation will be in 6 months, because it will be like a pilot project for me.
All right. Thank you very much, Ahmed.
So that's all for me. Thank you.
All right. I was looking for Eugenia, our next speaker, but I'm going to go to, I think she just disappeared from the room, unfortunately. So let me see if Kaushik is still here. Yes. Okay. Francois, quick comment from you, knowing that.
Thank you, Ahmed. I think maybe something which will come in when you develop your plan, it will be important for me to know the size of the problem of the defaulters you mentioned. Have you had the chance to go in the data and look at the size of your problems in order to make sure that the corrective action are really corresponding at the cause of the main problem which has been documented. But congratulations for your follow-up activities, weekly, monthly. I think this is one way to see if things work, so modify your strategy when needed. Congratulations for this focus on the follow-up that you put in your comment just today, but please give us, try when you comment to get more data on the size of the problem you're going to try to address the defaulters because of misinformation. Thank you.
Thank you, Francois. And again, if you'd like to continue a discussion like this one, I've shared the link to share your experience. So that's not a week from now, or it's tomorrow. Click on the link that you'll receive in the email that will be in your inbox at the top of the hour, or look through the emails you've received in the past. Now, before we move to the discussion around indicators, we'll have one more speaker on the corrective action, Dr. Kaushik Nag. Please don't forget to introduce yourself, remind us what's your goal here, and then specify one corrective action and answer the 4 questions you see on your screen, please.
Thank you, Red Sir. I'm Dr. Kaushik Nag, Assistant Professor, Community Medicine, Tripura Medical College from India. And this is my first experience sharing. So my challenge is fear of AEFI, that is adverse event following immunization, among adult people. And strategies to reduce the fear of AFI among adult people so that we can improve the vaccination coverage among adult population also. And one corrective action, maybe we can improve, do some health education session among communities, rural areas to increase awareness and to alleviate the fear among rural people. And regarding the have you implemented action like this? No, I have not done it yet. I just came to know this project in my last one of the conference where Reda Sir was one of the speakers in World Congress of Immunization. Who will carry out? It will be carried out by medical officer posted in the PSC, which is attached to our medical college. Then intern is posted there. Then the health workers and also the faculty. That is, I am the in charge of that center. Rural Health Center, so I'll be also there. I can monitor the activities, and I'm planning to do this project within 1 year. That is by 2023. Hopefully, I can finish, and I will know if you have succeeded. If with all of your guidance and blessings, if we can decrease the fear, hopefully we can increase the vaccination coverage among this adult population or geriatric population. And by this, if we can see the increased number of vaccination among this generation of elderly people, then we can definitely know that we have succeeded a little bit. Thank you.
Thank you, Dr. Kaushik Nag. Francois, a quick comment and feedback, knowing that we'll continue the discussion tomorrow at the experience sharing for those of you who are lucky enough, fortunate enough to be able to attend, but you're all invited. Francois? And I'm asking him to unmute. All right, he may be having a technical challenge of his own. So let's proceed to the next. Oh, Francois, go ahead.
Yeah, but I had a problem in connection that for these participants, I couldn't hear the priority problems.
All right.
There was a low uptake of the elderly population.
Should I tell again?
Sorry? Yeah.
Should I tell again?
If you can summarize quickly, yes.
Yeah, the problem is mainly the fear of AFI among the geriatric people or adult people. And I want to decrease this fear so that I can improve vaccination among the geriatric people.
And have you
I'm in charge of one...
What's your corrective action you're going to do? So your problem is, your challenge is very specific. Thank you.
I want to conduct some, health education session in my rural health training center. And it will be conducted with the help of internees, medical officer, and I'll also lead this activity so that I can reduce this fear among the common people, rural people, and hopefully I can improve the vaccination coverage among the adult and elderly people.
And have you had the chance as an action to understand better the fear? Have you had the chance to interview community to understand the fear of vaccination and match your corrective action, which is excellent, with the finding of the cause of fears?
Yeah, That is the main goal of my study, to find out
So,
the cause
so
of
you're
various.
doing as the corrective action and understanding followed up by education based on your finding of the studies, if I understand well.
Sir.
Excellent.
Yes, sir.
Thank you. Over to you, Reda.
Thank you very much indeed. So let's see what is next. And we're going to talk about indicators. Before we do, let's have a look at the next stages, next steps in the action plan questionnaire. And so this is really a guided process. Just follow along. You can look at offline. We'll share the Word document with you. It'll be in your inbox at the top of the hour. A reminder, we have 3,555 people who've signed up to develop an action plan, and it's a unique opportunity, especially in the experience sharing sessions on Tuesdays and Thursdays, to really hear firsthand from many more people than what we're able to hear today. So we'll ask you, after asking you for the 3 corrective actions, what else needs to happen to achieve your goal? In some cases, they're not actions you or someone else can take. If the roads are flooded and you cannot reach the remote community, that is an example of something else that needs to happen that you may not be able to take action at a point in time. Just one example. Read through the questions. We encourage you again to share your experience, to help, both to get help, but also to help others with your experience. And then we have a few questions about the general situation where you work. And this is going to look up indicators that can usually be found in your country's DHIS2. So to introduce this discussion, I'm going to once again lower all the hands, and let me go back to the questions here. So don't forget to introduce yourself. This time we want to know, you have a list of indicators here. So the size of the target population for vaccination, the number of outreach immunization sessions that were planned, and then those actually carried out, and then antenatal coverage, also known as ANC, and then, of course, vaccination coverage itself for different indicators. So we have 3 questions for you, and please raise your hand if you're ready to answer them. Do you know what these indicators are? Do you know where to find them? And can you explain why they are important? So let's have this one maybe a little bit longer before we hear from a volunteer. I see Hassan Benya has raised his hand, but I'm going to use the opportunity to share a little bit some of the many messages. So Dayo Adeoye from Nigeria, and Eddie Giddings, Eddie G. Giddings Sr., who says, good evening, everyone. Eddie and Dayo, please let us know. You can share if you're watching on Facebook. Let us know. Do you know what these indicators are? Do you know where to find them? Can you explain why they're important? So we have 4 hands that have gone up. Let's try to go to people who have not yet answered. So let's go to Usman Dania Haruna. Usman Dania Haruna, I'm asking you to unmute. I'm also asking, let's see, Hassan Benya, and then Marwa, John, and Samuel Malugai Badiakang. There's Hassan, yes, you're the first to unmute. So tell us, do introduce yourself, tell us who you are, where you work, and then do you know what these are? This list of indicators below, do you know where to find them? How would you go about finding them? Why are they important? Hassan?
Yeah, thank you very much again for the opportunity. I'm Hassan Benya, the analyst from Sierra Leone, supporting the Ministry of Health. So far, in terms of finding these indicators, in Sierra Leone, definitely our DHIS2 doesn't capture this. The indicators are in the DHIS2. But again, we are always having challenges to update our regular target population on a yearly basis. So sometimes how we are actually doing it, we have to make sure that we have an Excel base, simple Excel base, wherein we download the information. For instance, the total number of people immunized or ANC. We just download those information and then export it into the Excel sheet, and then we can easily calculate our coverages and then also our target population as per district and then regions. So that's how we've been doing our own. So in terms of number of outreach immunization that are planned, definitely we don't have that in our system. Yeah, that one I would say we don't have it. But what we have is we know the number of outreach that has been performed at district level. You know, our expected plan was we expect at district level to have a micro plan. The micro plan that will actually feed in the national level. But that one, in that micro plan, that's the time you have the number of outreach that supposed to happen. But that one is not captured in our DHIS2. But for the antenatal care, I think that one is always available in the DHIS2. We can see it in the DHIS2 at any time. Also, immunization coverage, Penta 1, 2, down to measles. We have all these things in the DHIS2. Then down to COVID. COVID, definitely we have a different DHIS point that is different from the routine immunization. We have the COVID and then we have the routine immunization. So all these variables you are talking about, we can find it in the routine immunization component in the DHIS2. Whereas also in the COVID-19 part, we can find the COVID, which is separate from the COVID-19. But we are planning to make sure that we integrate both COVID and the routine immunization. So I think in a nutshell, based on your question, we can find all these major of these indicators in the DHIS2. Thank you.
Thank you very much indeed. Before I go to Francois, I just spotted a message from Aisha from Sudan who says, I haven't implemented an action like this in the past. So Aisha, I don't want to put you on the spot, but I am asking you to unmute. We'd love to hear from you, just to hear who you are, where you work in immunization in Sudan, and maybe just to hear what questions you have about implementing an action like this. Aisha, Yahia, I know there are three Aishas in the room, so this is for Aisha Yahya, who shared a message. Of course, we have many hands up, so Aisha, if you... Okay, yes. Are you able to speak to us, Aisha? All right, I see the microphone is unmuted, but I'm not hearing you yet. So it may be a connectivity issue. I just thought it'd be important to reassure you and to encourage you to actually work through the guided process, join, if you're able to, the experience sharing sessions, and put together an action plan that you can use wherever it is that you work. But it looks like we won't be able to hear you. Francois, would you like to comment on what we heard from Sierra Leone about the indicators, obviously from a very knowledgeable technical person? What are your thoughts? And you'll have to unmute again. So this is Francois as well.
My first comment is thank you for sharing. And obviously, you know how useful are the indicators. I'm glad to hear that those indicators are available in the DHIS system, information system. I heard something where you had some difficulty to get the information on outreach plan versus executed because they are merged, but they're not 100% easy to find. These are compiled together, so difficult to reallocate to every district. And one thing, my only question is that how those indicators in Sierra Leone used well at each level, or is it a problem to use properly those indicators at each level, and why?
Sorry, would you mind to ask the question again?
No, I said, are those indicators you mentioned available, are they used for analysis at each level, or is it done more at the national level?
Definitely they are used at national level. But what I can see, most of these indicators definitely are not being monitored as per se. But for analysis purposes, when someone requested for it, we do it. Like, for instance, the issue of the outreach versus the fix. I can tell you, Sierra Leone, majority of our immunization interventions are being done at facility level. So, for instance, if you look at the outreach, it's below, if you check 100%, it's below some districts, it's below even 30% as you cross along. So we expect the outreach also to be higher as opposed to the fix. But definitely for the outreach, definitely I can tell you it's below 30% in most of the facilities. Yeah.
Thank you. Just highlight how important are those indicators to target your intervention and monitor over time the progress when you have discovered deficiencies through your analysis, and you highlighted the challenge of getting at each level people analyzing those data to make decisions. Thank you very much.
Thank you both.
I think before you move further,
Yep. Go ahead, Hassan, if you had one last point.
So the last point I have was there is a reason why you see people are not really doing outreach. The essence was people are getting outreach. We have what we call performance-based finance. So initially, people have been given some incentive to perform the outreach session. But definitely, the outreach session, this has not been forthcoming. So as a result, you find out that the fix is much more higher than the outreach because of that. Because people cannot move from one level to another. It has to be transportation and the like. So that has been the major challenges. That's the reason why for us, fix is much more higher than the outreach. Over. Thank you.
So I think you highlight a very important point. Maybe with fix is much higher and we understand the rationale, but I think the outreach is a complementary strategy to improve access to maybe remote communities that don't have access to your fixed sites. And I think you have looked in the cause analysis of the cause of this outreach, and you mentioned incentive and transport, but maybe that's where corrective action will take place for you to measure if you can increase from 30% your plan outreach versus executed to higher to 50 or higher. And this will indirectly correct some coverage and bring equity in immunization. Thank you.
Thank you, Francois. And to continue the discussion with Francois, I warmly recommend registering now for the experience session. It's happening tomorrow. We still have quite a few things to cover. I was hoping we could hear from Rebecca Akello and Annika Scott. Let me see if I can finish sharing with you the most important information you need to have in order to be able to make it through the hackathon, starting with why we asked you about indicators. So you can see here, we have a few questions about the general situation. And the way it works is you get to tell us, first of all, you tell us what's the name of your area of intervention. If it's called Kaduna State in Nigeria, if it's Abosi Ward, if it's Kwame Health Facility, tell us what you call where you work or the area in which you actually do practice immunization. Tell us if it's urban or rural. And then tell us, this is where we always ask you, do you know this? And if you do not know this, say no. All right, there's no wrong answer. If you say no, I don't know the size of vaccination target population, that's fine. You can actually skip that question. Remember, you're doing the action plan for you. Now, as you just heard, knowing the sort of basic numbers around your situation can be quite important. But you don't need to pretend you know what you don't know. So what is the size of a population here? You would enter the number. Do you know the number of outreach immunization sessions? So you may not know, and as we just heard from Hassan Benya, there may be a legitimate reason for why you do not know this. So this is not a quiz or a test. This is to help you figure out what actions, what corrective actions, as Francois calls them, are you going to take. And this is the plan, but starting on the 23rd of May, you'll be actually implementing your plan. You'll kickstart implementation. So you can go through this and you'll see all of the indicators that were up on the screen where we heard Hassan Benya describing and explaining. You know the antenatal care coverage. If you don't, you can say no here. If you have time, you have 2 weeks. You might want to go and look that up. Ask a colleague, figure it out, or you can just say no. Especially if you're in a hurry, that may be best. Of course, the more information you have about your situation, the more likely you are to build an effective action plan. But it is your action plan. We won't be grading or telling you if your plan is good or bad. We may give you feedback in various ways. And then we come to the vaccination indicators of Penta 1, Penta 3. And each time we ask you, do you know this for measles 1 and measles 2, and so on. And so that is really the essence of what you'll be doing in the last part, the final part of the action plan. Now, I'm hoping we can still have a couple of minutes to hear from our final speakers. You'll be receiving in the same email that will be hitting your inbox in about 3 minutes. you'll see a section called How Are You Doing? And it's important that you click on the green button to tell us, confirm that you are active in the movement. You may be busy, but take 30 seconds to tell us, I'm doing fine, or I have a problem, or if you choose to leave the movement, whether that's to take a pause or to leave forever, you can always come back still. That is what you get by clicking this green button. So we ask you this every week. And some of you say, why are you asking me? Well, this is the only way we have of knowing that you are still there. In the same email that will be in your inbox within a few minutes, if you were not here in Monday's assembly, so you must be watching the recording, again, to avoid removal, if we don't see you in the assembly, if we don't see anything, any signals from you, we'll ultimately send you a message, say, you're probably not active. Let us know if that's not the case, if you actually want to stay in the movement. And so it's important that if you miss a session, you click here to avoid removal. Again, should take you no more than 30 seconds. And then what we encourage is really the solidarity between members. So this is where you can help each other. There's a single link and you can see some of the actions, some of the messages being swapped here. Some of you, I believe, may be getting confused. There are two groups. One is announcements only. That is the one I recommend everyone join. And then the dialogue, I recommend that you turn off the notifications for that one. Otherwise, your phone will be buzzing all the time because there are so many people in the movement and so many messages. And last but not least, if you have poor connectivity, we'd really like to encourage you to listen to the podcast. So the link will be shared, has been shared many times. You'll find it in that same email. I'm sharing it in the chat now. And last but not least, for those of you who've been here since March, and soon we'll be introducing the Ideas Engine for the over 2,000 newcomers who've joined the IA 2030 Hackathon. You'll be able to search for ideas and practices in the Ideas Engine to help you tackle your challenge. So that is what we'll be doing. I want to go back now to, let's see, all right, we are out of time. I do have one last thing to ask you to do, and that is to continue to help us grow the movement for Immunization Agenda 2030. So I'm going to paste the instructions here. And the way this works is it is as simple as going to the movement page and clicking on the little WhatsApp button. I've actually shared the link in the chat for those of you who are in the Zoom studio, where you can actually just click that link and it will create the message for you, and then you just need to share with your colleagues. I know some of you have already done this, otherwise we would not be over 6,000 people in the movement and over 3,555 in this, specifically in this Action Plan Hackathon. But if you think about it, there are mighty country teams already. However mighty, they are a drop in the ocean compared to the number of people, health workers, health professionals in your country. So there are many more to reach than we have reached so far. So don't just keep doing the same thing if your colleagues don't respond. Instead, think about what is going to make the difference to help them understand why you are showing up every week, why you are here, and why you think it is worth your time to develop an action plan and to join and belong to and share with colleagues from the movement from Immunization Agenda 2030. That is it for today. I'm going to share that link, these links one more time so you can share once again. And for those of you who did not get to share today or even post in the chat, I would encourage you to you'll go to the Telegram group and share there. You can record an audio message with your testimonial. You can also just leave a text message, whatever works. There are hundreds, actually thousands of people on these groups and hundreds of people reading each and every message. So it's a very powerful way to share your experience when you don't have time to show up on the Tuesday or the Thursday for the experience session. And whatever you do, when that message has hit your inbox, check for it. You'll find the link to access to start developing your action plan. Don't start right away online unless you have a really good connection, because you need to do it all in one sitting. That's why we let you download the questions you'll need to answer before you start. And then I have one additional request. I see there's still 373 people in the room. So you know that we had over 1,000 submissions. Can you believe that? 1,000 submissions for the World Immunization Week photos. So I'd like to, before you leave, one more thing. After you have shared the movement, go to any of our social media and share the World Immunization Week photos. That's a great way of sharing, of supporting your colleagues in the movement. Over 1,000, I think, submissions, over 700 people. And all you need to do is one click to share. I'll share the links now. I'm just getting them ready. Here, there are 365 people still in the room. I realize we are over time. Thank you for your patience, but if you're still here, take 30 seconds to go click on any of the links I just shared to support your colleagues. And keep sharing the movement. You can go here if you have a few more minutes to stay. There's still 364 people in the room. I think there's actually more people joining now. And so, yes, Kingsley. Oh, I'm so glad Kingsley pointed out that you did not hear from Charlotte and Boo. Charlotte will be away for this week and next week. She was admitted into a very prestigious global vaccinology course that is taking place a heartbeat away from where I am, close to Geneva, Switzerland. So unfortunately, we'll miss her. We're actually going to call for a volunteer from the movement who would like to help facilitate the next session. So we'll be sharing that by email with those of you who have shown that you might be interested in helping during Charlotte's absence. Yes, thank you, Eda. All right. So here we go. We're going to share these messages one last time because there's still 343 people in the room. Let me see if I can switch. Yeah. Switch a little bit the music as we stay together. It feels like no one wants to leave. So here, if you have not done this yet, again, this is about supporting your colleagues, helping to grow the movement. And we know many of you have already made this absolutely amazing to reach heights we had never reached before. There are some francophones who are lost. We want to salute Ravi Melwani, Habibi Jallo from Guinea. All right. Dayo Adeoye, who says working on hard to reach. Many more messages. 302 people in the room. So I'll just share this again if you haven't done this yet. And we should see the numbers go up. If I go to the Instagram account. All right, Shona says, congrats to all my colleagues for good presentation. I think we haven't had applause yet to close the meeting, so certainly just going to show you when you get the how are you question. You can say I'm doing fine, you can say you have a problem, you can say I want to share my experience if you're doing fine. I'll show you the one thing. We ask if we can ask you 5 questions. If you take time, especially if something has changed, we ask you some very important questions here. Has participation changed you as a professional? And then you can tell us how. Has it affected your social connections? This helps us actually document and evidence what difference this kind of learning experience makes. There are skeptics. There are people who feel that this does not make a difference in that, or that this has not been proven. So help us prove it. If you are showing up every Monday, let us know why by answering these questions. And many of you have already answered probably several times by now, so it can be a bit tedious, but this is important because every week going forward, we'll be sharing the barometer that actually lets us know how the community is doing. Wonderful. Thank you once again.